Hi, everybody. My name is Anjali Desai. I'd like to welcome you to the 2020-21 season of IPHA's third Thursday Lunch and Learn web series, which is organized by the IPHA Education Committee. We dedicate this time every month to sharing our successes and even some of our detours that we've taken to get where we are in public health at this point. The point is to connect, learn, and strengthen the voice for public health in Iowa. We're very glad that you're here joining us, and we hope that you'll be back with a friend next month. See, we're always promoting next month as well. Today we have an interesting session where we have invited some of the co-chairs of IPHA committees as well as board members who will share their vast and interesting experiences being part of this great organization. So this is going to be a fun session, but I'd like to start with some housekeeping items. Your microphones will be muted and your video is turned off by the administrator during the presentation. You will be able to unmute yourself and turn on your camera during the Q&A session because we definitely want to hear from you, get your questions, and so on. You can also put any questions that you have into the chat or Q&A feature located along the bottom of your screen so that we can keep track of your questions and be sure that we hear from you during the session. The session is being recorded and will be posted to the IPHA YouTube channel after this session. So you can view it again, you can share it with your friends that maybe couldn't attend, and so on. So we do have quite a panel here today. I'm going to turn this over to our moderator, Lena, who will start off by introducing who we have on the panel and then get started with some of the questions.
Thanks, Anjali, and thank you everybody for joining us. We're so happy that you're here and that these lunch and learns are growing in interest and popularity. It's just such a great way for us to share the work that's going on by our colleagues across the state and today within IPHA. So I can't see everybody. There's enough people that it's several screens worth of names, which is fantastic. So just in case we have people on the call that are not members, not yet members, I should say, let me give a quick little overview of Iowa Public Health Association. So we are a membership based organization, a nonprofit, nonpartisan organization here in Iowa, and we bill ourselves as the independent voice for public health in Iowa. In fact, our mission is to unite and strengthen the voice for public health in Iowa. And you've probably heard me say this before if you've heard this spiel, that one of my favorite words in that statement is the word for, because we really are doing this for Iowans. Everything we do, this lunch learn session, our networking sessions, every time you see IPHA quoted in the media, we are doing that for the health of Iowans. So we're happy that you're here today. We encourage you, if you're not yet a member, to join IPHA as a member. It's membership dollars that support us and allow us to continue the work that we do every day to support the health of Iowans. So today we're focusing on leadership opportunities within IPHA. Kind of what is our vision? What are we doing? What's coming up next year as we close out 2020 and look ahead, look beyond the pandemic, hopefully. What are we going to do? And so we've invited our board members and committee chairs to be with us today and to kind of give their perspective, not only their perspective of where IPHA is going and what their current role is here, but because we know we have students on the call and people who are not steeped in public health, it's always interesting to know what is people's background, what led you to public health, especially those who didn't necessarily train in public health and are now seeing how public health intersects with their specialty areas. So let me first introduce quickly the windows that you see open of who's on the screen, and then I'll kind of toss some questions out to people. So from our board, we have Jeremy Whitaker, who is our incoming. He will be president. He's president-elect now, so he'll be president of IPHA starting in January. Katie Reese is a new board member. Mary Menser Hansen she started her second term on the board. So as a IPHA board of directors they serve for 3 years, and you can serve 2 terms, 2 consecutive terms as an IPHA board member. And what's interesting about our board compared to other nonprofits is that we do elect our board members from our membership. That really gives us our board a vested interest in IPHA because they are members themselves. So, and then we also have on the call Angie Doyle-Scar, who is also a board member in her first term, I think. And then committee co-chairs that we have on the call, Isla Heater. I never know if I'm saying your last name right. I'm sorry. I need to do a better job to memorize that. Especially someone with my first and last name. I know the importance of getting that right. So I apologize. But Isla is our communications co-chair, and Anjali Desai is our education co-chair. So with those very brief introductions, let me pitch it to Jeremy as our president-elect and say, Jeremy, can you just give us a little bit about what you have a very interesting background that spans beyond public health. So can you just give us a little bit about your background, and as what inspired you to join the board, and then kind of what's your vision of leadership going into 2021?
That was like 3 questions, and I'll do my best. I got into public health because I wanted to help people, and I was actually the world's worst social work major. And I found public health as a way to be able to fulfill my passion for helping people, but not with the one-on-one counseling, which I'm not very good at. As far as what my role in public health, I started off at a local health department in Northern California doing infectious disease policy, moved to IDPH in the tobacco division, was at Wellmark in operations, was at the Iowa Hospital Association in government relations. And along the way, I finished a doctorate, and now I'm in higher ed overseeing the public health undergrad degrees at Wartburg and Allen College, which is a lot for 15 years. It feels like I've lived 2 lifetimes. Your other question of the future of IPHA and about public health in Iowa is that if nothing else from this pandemic, everyone knows what public health is. I don't have to explain it anymore to people, which has been a blessing in disguise. And where I want to see IPHA and public health in general is sitting at more tables. I want us on planning and zoning committees and on school boards and on city councils. And even if we're not elected to those positions, invited to those meetings where we have a really kind of established a beachhead of why we're important in all parts of society, not just in our silo.
Great, Jeremy, thank you. And I will also say that Jeremy did not include in his bio that he is a veteran and served as a meteorologist.
I was first an air traffic controller, so I have an FAA certification in air traffic control. Do not ask me to bring a plane in. And I was also a meteorologist with deployments to Bosnia and Kuwait along the way. That was before all the other stuff I just talked about. So,
yeah. So I love that we have such diversity in our experiences, because that diversity just brings in a real world perspective, even if we don't think it's related. As we look at climate change as a public health issue, we have somebody that has, a different understanding of that background than the rest of us do. So I'm going to now pitch it to Mary as a retired professional and a board member. What does it mean to you to be able to stay engaged in the public health community as a retiree?
Thank you so much, Lena. First, probably I'd like to talk a little bit about me and why they allowed me to be on the board. And my background is that my career is a nurse. I'm a nurse by career, and ended up then getting a PhD. And then at that point in time, I decided public health was something I really loved. and I became director of the Iowa Department of Public Health under Governor Vilsack. And I would often tell people that as a nurse, we do one-to-one or group of patients. As a nurse, my patient population was 3 million Iowans. And that's what you can do in public health. You can influence so many people's lives by what you do. The irony of it was that during my tenure as director of public health, the major focus was pandemic. And as I tell people, it is very scary because my family and all of that look at me and say, okay, why won't you leave the house? And I have not been in a store for 8 months. Now I will fess up and say I did go and get my hair cut and colored. But besides that, what I know is I got educated, let's say, and perhaps overeducated by the work that the department did during my tenure as director in public health regarding a pandemic. But it also showed me what heroes public health professionals are and healthcare professionals are as we went through doing this. After I left being health director, I became faculty at the Masters in Public Health program, and a shout out to Dr. Duffy out there who I worked with, and at Des Moines University. So all of that was the background that I bought. And as Lena said, my profession now is being retired. And as I have told people before, as a retiree, one of the things I'm doing is pickleball, but I also wanted to stay in and make a difference. And the best way I could do that was being as a member of the Iowa Public Health Association. So from that, that's what drove me to be a member of the association and to stay involved. One of the things I will say too, when I was a nursing student, one of the things that we were told by our faculty was that part of your responsibility as a nurse was to be a member of your professional organization. And as we carry through on that, one of the things that I believe too is that, particularly with public health, a big part of our role is to make a difference in policy. And as we look both at the pandemic, but as we look past the pandemic and looking at what is public health all about, public health really is all about influencing the environment where people can become more healthy. We know that the social determinants of health are so critical. And to me, Iowa Public Health Association, in work that they do, both in many of you, how many of you have seen, you can raise your hand virtually, have seen Lena on the news? And we thank you. I raised both hands. And what we've been able to do, I think, is really make a difference in advocating and giving people wonderful information about what we need to do. And I want to see that continue. My vision of public health is that that role will continue and expand. And some of you may know that the earliest thing, or I shouldn't say the earliest thing, what people are doing now in public health is advocating for us to be health strategists, those people who bring people together from all sectors. We know that public health is important, that everybody advocate for it, and that we are the foundation for, frankly, I may be biased, but we're the foundation for business, for people to have a quality of life, for business to even want to come to Iowa. And so I hope in the future that we'll continue that role of advocacy.
Welcome to Zoom. Enter your meeting ID followed by pound.
Does that mean I'm cut off, Lena?
That's your Oscar music, you know, stage left.
I love it. So anyhow, thank you for having me, and just what a wonderful profession.
Yeah, thank you, Mary. And I will say that I mean, if we look at silver linings and believe that a crisis presents an opportunity, this really has been a year of opportunity for IPHA to highlight the important work that we all do. And yes, it's been my face on and my name in the media, but I do feel like this is a collective voice, because it is, and I'm proud to represent that, and I'm proud of the invitations that we've receive, not just in the media, but to sit at a roundtable, a weekly roundtable with the Department of Education. I don't know that public health would have been considered a stakeholder in education had it not been for the pandemic. But I think now that we have formed that relationship, that will continue. I just received a request this morning to contribute a 2-page spread article to the Iowa Association of Counties monthly magazine. And again, that I don't know that opportunity would have come had it not been for the need for public health to be highlighted and public health evidence and science to be highlighted because of the pandemic. So silver linings, right? So I want to switch now from the board to our committees. I will welcome Hannah Schultz to your Brady Bunch screen. She is a co-chair of the advocacy committee. But first I want to actually go to Isla. Isla is the chair of our communications committee, and she and Ann Abbott are the 2 co-chairs, and they've really been keeping me on task as best they can to make sure that we are very strategic in all of our communications efforts, and from social media to our website to toolkits that we put together, and even forming relationships across committees. So our 3 major committees that we have are communications, advocacy, and education. So Isla, and then the other reason why I wanted to pitch to you right away, Isla, is because so Mary talked about the importance of staying engaged in retirement, and you're probably earlier in your career than a lot of us here on the screen. And so, and just talk a little bit about your career path and how being in a leadership position with the IPHA is benefiting you in your career.
Sure, thanks, Lena. So I'll start by saying I kind of followed the traditional route to get to public health. So I got my undergraduate degree and then went straight to my master's in public health degree at Des Moines University. I was super excited to see Dr. Duffy on here because I had her as one of my professors. But I graduated in 2018, and right upon graduating, I wanted to make sure that I would stay in the loop and connected to public health. And the best way I felt to do that was join the Iowa Public Health Association. I got a job as a project manager at Primary Healthcare, which is a federally qualified health center here in the Des Moines area. And we're also located in Ames and Marshalltown. So I get to do a lot of hands-on work in healthcare and public health, but I wasn't necessarily doing as much of that public health advocacy that I love. So I joined the IPHA, and then in April got into this role of the communications co-chair with Ann Abbott. And so it's just been a really great way to stay connected to public health and be part of these conversations that are building public health in Iowa. As Lena's talked about, the pandemic is super unfortunate, but it's a way for us now to leverage off this pandemic and stress the importance of a really sound public health infrastructure in the state. And so I feel very excited and privileged to be a part of public health in this state and time. I think I answered all of your questions.
You did, but then the one that I forgot to ask was what's coming up with the communications committee, and if somebody has they have a similar interest to you, and maybe their current position isn't scratching that itch for them. What's coming up on the communications committee? And Anjali and Hannah, I'm going to ask you the same question, so be prepared. What can people do, and what's the time? That's often what we get asked. So what's the time commitment, and so how can they pitch in and do some of that work that they want to do, that they're interested in, and share their experience and not be overwhelmed?
So Anna and I have been working on really building the communication infrastructure. So the thing that we've been focusing on is optimizing our website and just making it more user-friendly. And that's been something really tactical that we're working on. But here in the coming months, we're going to have various projects that will build out. And a lot will be around, as Lena mentioned, just really strategic communications, getting messages across out to the audiences that we want, especially in this time when everyone is talking about public health. We want to make sure that we are getting in the communication channels that people know who IPHA is, regardless if they are public health professionals in the field. And so we can build that out so the public will continue to look to IPHA. And so I think in time commitments, we are willing to work with anyone who wants to be a part of the communications committee. And it can be very specific projects that probably don't take more than a couple hours a week or even a month.
And I will add too, it's a great way for students also to get involved and participate in kind of and even build their CV. I know Anjali invited me to speak to her class. I think that was probably the last in-person meeting I did last February before we shut down, was I went to visit her class. And one of the things that we said is like public health is by nature collaborative, right? And right now you have your cohort of students and you're on group projects and you're doing everything. But in a few months, you guys are going to be competing for the same job, right? That's part of the reality of graduating too. And so being able to put on your resume, put on your CV, some of the work that you've done through your professional association, whether that's presenting at the conference or whether that's showing your portfolio of the communication pieces, the website pieces that you've written, it's a great way to kind of build that portfolio. So since I segued to education, why don't you probably predict that, Anjali? Why don't you talk about the education program and programming committee and some of the things that we have coming up and ways for people again across their profession, whether they're students, working professionals, retirees, to get involved.
Okay, I'm going to take just a couple minutes at the beginning just to kind of give my circuitous path in public health. Because IPHA was sort of an important piece of that. My name is Anjali Desai, and I am a faculty member in epidemiology at the College of Public Health at the University of Iowa. I started out as a microbiologist way back, and then moved into public health because I really wanted to work more with people and not just in a laboratory, at a lab bench. And one of the first opportunities that I had actually as an MPH student to do my practicum was at the Oklahoma State Department of Health. And the person that I worked with at that time, one of the people was the state epidemiologist, who was Patty Quinlisk. And she, just when I joined the state health department in Oklahoma, she left Oklahoma and came to Iowa and became the state epi here. And it was really great to be able to reconnect with her when I came here. But after getting my MPH and working for a little while in Oklahoma, I got my PhD at Emory. My husband and I have lived all over the country, and most recently in Missouri. We lived in St. Louis for 13 years. And I moved here in 2016 to direct the MPH program at the University of Iowa. And one of the first things that I wanted to do, which I must admit I didn't do in the other places that I lived in, but now I wanted to join the Public Health Association. And I heard a lot about how active IPHA was. And I thought that that was really important for me to be involved with IPHA, but also to get students involved. And especially in my position at the university, I felt that it was important, I think Mary mentioned this, for students to be involved in their professional organization as early as possible in their training so that they start to make those connections. The thing that I like best about being involved in IPHA is it's a small organization, so you actually get to know people and you get to meet them often. There's several people that are on this session today that were on the advocacy training session that we had on Tuesday, right? So you get to see people, you get to know them, you get to see what they do and how they're involved in public health. So that's really important. Another piece of what I do now is I work with two national organizations on training public health practitioners, because we know that only about 20% of public health practitioners have formal training in public health. So ongoing training, education, programming is really important. So when Janine asked me a couple of years ago, would I be involved with the Education and Programming Committee, it made sense. It fit in very well with all the other things that I seem to do. And it has been really a good opportunity to get to know people in other sectors who are involved in public health, who want to be involved in education and programming. We've worked with people in planning, we've worked with people in library science, we've worked with traditional public health people, but it's really a great opportunity for us to know what public health practitioners need and want around education, also around ongoing training, continuing education kinds of things. And so those are some of the things that we have been looking at. Not only formal kinds of programs that we might want to do around strategic skills and so on, but also informal things like the third Thursday Lunch and Learn, opportunities for people to share what they're doing, and not only successes are great, but also where they're struggling, where they could need help, where they could use some input. So it's been a really great experience for me to be able to apply what we teach our students, the other work that I'm involved in, but also to see what's happening in Iowa and to be part of that. And just as a last thing, when it was time for the elections, I worked as a poll worker, as I think many of you may have also been involved with. And so I sent Lena an email saying, I need an IPHA t-shirt to wear when I go to work at the polls, because people need to know that Iowa needs public health and America needs public health. And so I think we get to share our message all the time in many different ways. And this is a good group to be involved with to do that.
Thanks, Anjali. Listening to you to speak, I realized that I didn't actually introduce myself and my background as well. I think most people on the call do know that I'm the executive director of IPHA. But before that, similar to Anjali, I'm not a native Iowan. I moved here in, 2013. I've lived many places around the country, around the world. I call Minnesota home, but in truth, now that I've been here in Iowa for 7 years, this is the longest I've ever lived anywhere in my life. My career path started, I've worked in local public health, local, county, and state public health in Minnesota. I was with the World Health Organization for 7 years in Geneva, Switzerland, where I did a lot of strategic planning and writing, and that's where I really kind of honed my health equity interests and skills as well. And then I was a trailing spouse while my husband completed his PhD and postdoc rotations. And so that's kind of when I landed in Iowa and we realized that we're going to be here for a while, I knew I needed that network too. Just like Anjali, I needed to kind of break into the field, so to speak, and introduce myself. And I knew that the best way to do that and to gain colleagues, especially since I was only at that point interested in doing consulting work, was to have a network that I could meet people, find mentors, introduce myself to. And so really the first professional thing I did when I moved to Iowa was I joined IPHA cold, sight unseen cold, sent an email to then executive director Janine Moody and said, I'm here, here's my resume, how can I help? And that was my path and my start with IPHA. And I got involved in committees. I think a lot of people on the call know Louise Lex. Louise reached out and said, Lena, you need to join the advocacy committee. And people by and large don't say no to Louise. So I joined the advocacy committee. And then Janine needed some grant writing done. So I did some grant writing and, I attended days on the Hill and, just kind of showed up wherever and whenever. And that's how I built my network. And so for those of you who are new to Iowa, new to public health, students, this really is the best way to get started in your career and in building your network. So just to round out our committees, I'm going to toss it to Hannah. And some of you may have been on calls that we had recently. It's been a busy week for advocacy, even though the legislature is not in session right now. It's been a busy week, and we've been doing a lot of relationship building this year and sharing messages of public health. So Hannah, do you want to introduce yourself and talk a little bit about what's been happening with the advocacy committee and where we're going?
Sure, thanks, Lena. So I'm Hannah Schultz. I work at the Institute for Public Health Practice at the University of Iowa College of Public Health. Our big project there is the Midwestern Public Health Training Center, which might be a bit more known than the Institute for Public Health Practice. And I have been co-chair of the advocacy committee for, I don't know how long. I became co-chair after COVID started, so sometime in the last 9 months. But it's been a very busy few months. I joined the advocacy committee. I think it's been about 2 years. So I started at the College of Public Health just over 2 years ago, and the former chair of the advocacy committee was Brandon Rohrig, and he has since left Iowa, unfortunately, but he and I worked together previously at one of my last jobs. And when I came to Iowa, he called me right away and said, by the way, I just added you to the advocacy committee. He didn't ask, he just kind of drafted me to it. I was like, okay, yeah, I'll do that. And now here we are a couple years later, and I got drafted to be co-chair. So it's been really nice. I joined IPHA the day I started my job at the College of Public Health, which was, it was great. At first, you always hear that you need to join associations, and professional associations are really important. And I previously worked at the National WIC Association, so I knew the importance and value of it, but sometimes it's hard and a little intimidating to just like start attending meetings and things. So Brandon pulling me into the advocacy committee was really helpful for feeling like I'm a part of the association. I'm looking at the names here now, and I recognize a lot of you, which is pretty cool considering I've met most of you in the last year or so when we haven't even seen each other in person. So it's been nice. The advocacy committee has a couple of big events each year, including the legislative forum, which is in a couple weeks. And I will put the link in the chat because you should all come to it. It's going to be a great event. And the Day on the Hill. And Day on the Hill is at the beginning of the year. I don't have too many details on that right now. Deborah Thompson, who's the other co-chair, is planning that. It will involve some sort of virtual component, but what that's going to be is a bit unclear to me right now. We also create a legislative agenda, which helps Lena as she makes statements about different policies and things throughout the year. And we're available when legislators have questions about public health or want an opinion on something, they can contact us. And we also partner with the communications committee and education committee on different things to make sure that we are trying to be the strongest voice for public health as we can.
Yeah, thanks, Hannah. And I'll add that, so the legislative forum that Hannah mentioned, I think I went back and tried to count because, you always want to add the such and such annual. Well, I believe this is our 15th annual this year. And that is a day, it's typically a day-long event that's held in person, obviously. And this year it's not. And the day consists of different agencies and nonprofits sharing their legislative priorities and policy priorities. It includes a panel of state administrative offices. So this year we'll have IPHA DHS represented by Kelly Garcia. We'll have Department of Corrections represented by Director Beth Skinner. We'll have senior members of Department of Education and the State Hygienic Lab there as well. So it's a really neat opportunity for people to hear from state agencies as to what their year ahead is looking like. And then we round out the day with the state legislator panel. And we have, we always do our very, very best to make sure that that panel is bipartisan and represents both chambers. And so I don't know if he's still on because it's, like I said, multiple screens. Representative Bergen is, yep, there he is, is going to be one of our panelists this year. He was last year too. And it's always great to hear him and have such a strong partner for public health. Hannah, you'll have to remind me who the other speakers are this year. I know Senator Mathis is one, and Representative Wessel Chriselle, I believe.
Mm-hmm.
And we're
Senator Mark Costello as well.
Oh, yay. That's a new one from since yesterday. And
I was
so,
told that this morning, so I hope it's true since I just told you.
well, now it is. We'll have to hold them to it. But one of the things going virtual this year made us rethink and reconsider, as the whole year has been, word of the year pivot, right? Was looking at, so it's always great to have the 4 legislators that come and speak on the panel, but we know that that there's a need for just more advocacy, more learning, kind of public health 101 across the spectrum. And so this year, Hannah and Deborah had the great idea of doing a public health primer for elected officials, and that was held on Monday morning. And we had over 30 legislators on the call for 2 hours talking about public health. What is public health? Mary was one of our speakers for that. And former IDPH Director, State Hygienic Lab Director Chris Atchison was also on there, as well as Kevin Green, who's on the call today. And really just giving kind of what is public health in general, what is public health in Iowa, what is the local perspective, and how can legislators and elected officials support public health, and really, that wasn't a lobbying question. It wasn't, we want you to vote yay or nay on XYZ. It was get to know your local public health directors, go meet with them and ask questions about public health, ask your IPHA members about when you have questions about how does this policy in transportation that I'm considering voting on, how does this impact the health of our community, and asking questions like that. And so it was a great forum that I think we are now bound to repeat every year, because it was it's such a great educational event. Okay, so with that, and I see Hannah did put in the chat the registration for the Legislative Forum. I'm going to round it out with Katie Reese, she's just finishing up her first year as a board member. And Katie works for the Iowa Medical Society, which is also a membership organization. And I'm so grateful to have Katie on the board, because she has opened doors for us. And we've always talked with, the IMS, especially up at the Capitol, we have, similar interests, but the relationship has grown and strengthened, and the understanding of how clinical health and public health work in synergy, and that's due in part to Katie's work and advocacy. So Katie, I'm going to ask you to introduce yourself, talk a little bit about exactly that synergy, but then I'd also love for you to talk about some of the work that we're doing, especially this year with the calls for racial and social justice, and the seriousness in which the IPH board is taking that, and development of our anti-racism statement and our new DEI task force, if you would.
Yeah, happily. So really excited to be able to chat with everybody, kind of the same with Hannah, seeing some new faces and new names that are on there, which is exciting for those of us who've kind of been in the public health bubble for so long that it kind of feels as though we see the same people, and it's kind of like preaching to the choir all the time. So as Lena mentioned, my current role is with the Iowa Medical Society. So over the span, I have my master's in public health that I got from Benedictine University over in Lisle outside of Chicago, Illinois, which I got right after I did about a 3.5-year stint of being an expat. So I spent a lot of time living in Italy, working in Europe, and kind of their version of the Peace Corps type pieces. So that's really where my passion kind of came into place, to see how that works in various different areas. How do we be creative? And what's the realistic kind of aspect when we go through, we get our master's degree, we get trained in public health. What does that look like in real life as we're kind of going through it? And often, I don't know, for you guys, we were kind of trained, how do you know you're doing a good job in public health? Is when no one knows you're doing anything at all. They just buckle that seatbelt. They have clean drinking water. So we've not always been really great about saying what public health is. We've always kind of been on the backside and kind of the original unsung heroes. And I think that's particularly where for IPHA coming into place, and again, taking advantage of the opportunity with a pandemic to say, okay, this is an amplified opportunity to express what we do, and to not just be those folks, as I like to say, kind of the folks on the periphery, but really sitting at that table and driving some of those different things. And I think particularly with that synergy with the medical society, I will say, even pre-pandemic, there has never been a better time to be in public health. Our entire healthcare system is transforming, and it's based off of public health models. And so I have worked in quality improvement with CMS and with a variety of others for a while. And I'd have to be that person in the room constantly saying, when we have very well-intentioned physicians and nurses who are used to that one-on-one care, that are more used to that, and saying, well, how would we do this? And be like, we know kind of how to do that. Like, we've got a model from 1972. Let's bring the on how do you apply those care coordination, population health models, and that shift that's been in there. So I think that synergy that we talk about is not just an advocacy, but I think it's an everyday practice. Things are coming together. The world that we're wanting to see, we're in a position to help make that happen. And that happens by being at those tables, but being more vocal about what that looks like. But I think by also being connected to all one another, and to say, what does public health look like? You know, routinely we say, what isn't public health? And to know the diversity of what that brings to the table, and knowing, you know, we frequently say, oh, you're the public health person, Katie, tell me all about it. I'm like, I am a public health person. I know this part of public health. And it's really how we amplify our profession, is by being together and by knowing these pieces. Routinely, I'll say, hey, I'm having a conversation, and, you know, I'm not the right person, or I've got a little bit of knowledge, but let me hit back with some of my other folks that are in IPHA. I know I have connections to those other people with that expertise and experience to make what we do better. Because at the end of the day, I think through IPHA, we have the opportunity to not only advance our profession as public health professionals, not only for each other, but with and by each other, but to really make sure that we're part of those tables, advancing those different things. You know, and as Lena mentioned, you know, something that we've recently done, not just in the pandemic, but our entire world in 2020 has been in shift, every single aspect of it. And kind of really even that reiteration, that refocus, and the public attention towards issues of inequality and injustice. And, you know, I know everyone can say the names of, you know, George Floyd, and they know Breonna Taylor, but we don't always recognize that they unfortunately are one of so many names, hundreds of names just in the last, you know, 5 years alone that had kind of precursored that. And so as a board, we kind of took the opportunity to say, one, we recognize that racism is a health threat. We recognize social determinants of health that are so closely tied in with ethnicity, gender orientation, all of those pieces that come into place. And it would be not only an ethical issue and, you know, professional misgiving for that, but as human to human, for what we stand for public health, is for us to stand up for the lowest among us, the meekest among us, and what that looks like. And so we put a statement out, specifically responding to that, and, you know, committing ourselves not only where I think it kind of became the phrase du jour to say, oh, we're not for racists, and, you know, and not just say we support people, but to really put ourselves on the line and to say, we also recognize we can be part of the solution, but we are not the solution, that we need to learn and listen, and we need to explore those different pieces. And so you'll see that we had put the statement out, and I see Lena had put our statement that was out. And then we also have a task force. So recognizing that this isn't just a sentiment of the situation, but this is something that we're very much committed to being core to what we do. And so convening a task force of making sure, from members, from non-members, community leaders, a variety of angles, to say we need to get people together and say exactly how do we do that. We gave ourselves some specific and intentional charges on what that looks like, that are not only challenges for our organization, challenges for us personally, but I think challenges also for our profession to not just talk the talk, but walk our walk, and to learn the process as we go for that. So Lena has the link that's in there. And so I would encourage, not only for yourselves, but if you have other colleagues or partners, again, maybe they're members, maybe they're not. That is not the requirement necessarily that's in there. But to share that survey out there, engage with people on that front. Because this is an area, again, that I think not only can we lead the way on that, but we can have partners that are advancing the entire system around us. And it doesn't have to be just kind of public health banging on the door, asking somebody to listen to us. But it's an incredible opportunity to take advantage of the time that we're in and make sure that we are moving everything in the right direction from that. So I think that's really kind of the excitement that I think for this next year that we have kind of going. And as we're looking through, getting through the rest of 2020, it's almost Thanksgiving, but we still have a little ways to go before that January 1. But I think that would be an incredible opportunity, and encourage you, especially if you've got folks that are maybe on the fence on what that looks like, or maybe thinking, how much, getting into a full committee and that commitment, but a little bit of opportunity here with that as well.
Thanks, Katie. And yeah, I did put the link to I'm calling it our interest survey for our diversity, equity, and inclusion task force. And the reason I say it's an interest survey is because we've had great response to people who are interested in helping us with this work. And this initial task force is really, the charter is to help us look internally. As Katie said, we want to be part of the solution, but we also know that we might be part of the problem. And so the first hard step is looking internally and saying, what are we inadvertently doing that is not consistent with our journey of being an anti-racism organization? And so we're asking people to come together, help us look at our board, look at our bylaws, our policies, our programmatic, the way we deliver, and all that, and make recommendations for us, whether that be everything from bylaw changes to form a new group, or go in this programmatic direction, but really make those changes that are for the better. So that link is in there. The next link I'm going to put in there is an application to become a member of the board of directors. So our board is a 12-person board. Angie, I see that you're still on, but your camera's off, so I'm not sure if you're still here or not, which is why I haven't called on you. There she is. So we do have a 12-member board, and like I said, it's a board that's made up of and voted on by our volunteers. So I can't go out into the community and say, hey, you business leader, come join our board. No, first I have to go say, hey, you business leader, come join IPHA, and then join the board. But we are in our election season for our board members. So I will put the board, the link in there for that. That is the only position within the IPHA leadership structure that you have to apply for and be voted on. Any of our committees that you just heard about, anybody can join any of those committees. So I welcome you to reach out to Anjali, to Isla, to Katie, or to Hannah about those committees. You can send me an email and I'll forward it to them, or I will also put the committee emails in the chat box as well. But for the board, we do seek applications, and there's an election process. Angie is our treasurer on the board. And she works for, Angie is with Iowa Department of Public Health. And so the reason I point that out is because just to show the variety of stakeholders that we have on the board. IDPH is a member of Iowa Public Health Association, just like many local public health departments are. And what's great about that is that assures that relationship, but also allows for an independent voice for public health. And so I think it's a great connector. And also to show, the reason I'm pointing out Angie is to show that where you work does not determine your ability to be an IPHA member or to serve in a leadership position. Angie's careful to draw lines and excuses herself when there's a potential conflict of interest, but it's a great asset to have her on the board. So Angie, why don't you just real quick introduce yourself? We're 10 minutes out. This has gone very fast. So I do want to save time for some Q&A, but go ahead and say a few words and I'll
just take 2 seconds because I have virtual learning with boys right now that is not going very successfully. That's why I had turned off the camera so you guys didn't hear me yelling. So I'm Angie Doyle-Scar. I work at the State Health Department. I have been there for many, many years. My background is policy and outreach. So in government relations in my previous job. So that's, and I'm a board member of IPHA. I have been a member for quite a few years, and it is a great way to really participate in public health on a statewide level. So I encourage anyone that is not a member to become so.
Thanks, Angie. Sorry to put you on the spot there.
Okay.
My virtual learning days start tomorrow with all 3 of my kids. I'm not sure how that's going to go, but you know, we'll, like everything, we'll trudge through. But I just put the link in for the board applications. Really the only requirement to being a board member is that you have been a member of IPHA for a year, and that you're willing to answer the questions that we ask on the application. We are seeking this year, we have 4 open seats this year. We are seeking to diversify our board in terms of race and ethnicity, in terms of geography, in terms of gender. Jeremy and Jake Riley represent the 2 that represent the masculine side of public health. So
and 2 out of 12 is pretty good, honestly. I think
public health it is, right?
Representing, looking at the names on this, about 10% male in the field. So yeah.
But we also want to represent geographically. We know there's an urban-rural divide, I shouldn't say divide, but you know, there's different urban and rural concerns across Iowa. We want to make sure that we truly are a statewide organization. So with that, and then the remaining 8 minutes we have, why don't we open it up to questions? If anybody else is maybe new to IPHA, wants to introduce themselves or ask questions about any of the specific committees or boards, we'll just open it up. And I think I maybe need to allow people to unmute themselves. Let me see if I can figure out how to do that.
Hi, Lena, it's Leslie. I'll go. You can unmute yourself. We have that
Okay,
power,
great.
so you don't have to figure it out. I'll end us on that little happy note. I just want to jump on. This is my first Lunch and Learn. We are new members to the association. I'm with the Iowa Heart Center Foundation, and I've been here for a little over a year now, and part-time with them. And then we also have one other part-time staff person. So like most nonprofits, we're pretty under-resourced. And Laura is my counterpart. She's our program person, and she is actually on an American Heart Association Lunch and Learn, so she couldn't join us today. We're dividing and conquering, but we are happy to be in this space and look forward to really helping see how we can move heart health forward in our state as a public health issue, and have been working with the Department of Public Health already on some of that work, but it's an area where Iowa is not doing so hot and haven't been for a while. So we're excited to really reinvigorate that work and see how we can move it forward together. So thanks for welcoming us to this space.
Thank you. We're very happy to have you guys. And I think we need to move the needle on many things that Iowa could do better on. Anyone else? One thing that none of us have mentioned, and I might pitch it to Hannah again, is our Thursday networking sessions. So every Thursday afternoon, we call it IPHA Connect. And, you know, as informal as this is, that is even more informal. We started that really at the beginning of the pandemic, because we knew that people just needed a space to connect and maybe vent, laugh, get ideas, share stories. And Hannah has been a frequent member of that group, and several of us have affirmed that it's one of our favorite moments of the week is when we can connect with our public health people who get it, and you know, maybe make some silly jokes that make us all laugh and appreciate the levity of it all. So Hannah, do you want to maybe see if you can find the Zoom link and put that in the chat? Okay. Well, I see that we're getting kind of close to the top of the hour, and people are exiting to attend their next Zoom meeting, I imagine. But if there's anything else that people want to chat about, we're still here for another few minutes. Do any of our board members or chairs want to have any closing comments?
I'll just add that I did drop the communications email in there if anyone is looking to get more involved with our communications committee. And thank you, Lena, for moderating so well and hosting the forum.
Thank you.
I just put the link for the IPHA Connect in there as well. Lena's right. It is a very fun hour or two or however long we stay on. We've never stayed on more than 2 hours. I spent all day yesterday thinking it was Thursday and looking forward to it, and had to continually remind myself it wasn't, and it was devastating every time. So please join us if you want to hang out with some other IPHA people. It's super, super, super informal. Sometimes people grab a drink and treat it like happy hour. Sometimes it's a break in the day as we continue working beyond it, but it's a really fun time.
Well, as we close out, I'm going to share my screen again just to show you the upcoming Lunch and Learns. As we said, this is an every Thursday event. Anjali, do you have the spiel there that we usually say at the end?
I do. I guess I'll start off with thank you to all of the panelists, the board members, the committee chairs for joining today and sharing your experience with IPHA, with our attendees. And thank you to all of those of you that joined us and shared your time, your lunchtime with us. As you can see on the schedule, the next Lunch and Learn is on December 17th, where we're going to talk about election analysis and public health advocacy. So that sounds like it's going to be really important, a really good opportunity to talk more with each other. As I mentioned when I was talking about the Education Committee, we look forward to hearing your ideas, things that you want to see, anything that you would like us to include as a Lunch and Learn topic or otherwise as an education and programming topic. And then lastly, as a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our mission. So if you joined us, we're very happy to have you come and join us at these Lunch and Learns. We also appreciate you considering joining IPHA. And for any students that are out there, remember your departments, your programs may offer funding to join your professional organization. So check that out and see if there are funds that could support your membership. And to all of the members that joined, thank you very much for your continued support. And we appreciate any donation that fits within your budget. Recordings again of all Lunch and Learns will be archived on the IPHA YouTube channel. Thank you all for joining, and we'll see you in December. Have a wonderful holiday next week, and enjoy some time off, some relaxation, and thanks for joining.
Thanks, everybody. Stay well.